Good afternoon. I'm Attorney General Eric Schneiderman. I want to thank you for joining me today for an important announcement about an extremely dangerous and potentially fatal threat to the people of Buffalo and the entire region. I am very proud to stand here today with some of Western New York's true leaders in the fight against the current drug epidemic. Our great county executive, Mark Polenkars, Dr. Gail Burstein, the Commissioner of Erie County's Department of Health, Deborah Smith, who's on the Opioid Epidemic Task Force, and from Save the Michaels of the world, Avi Israel, longtime friend and ally in this fight, Cheryl Plasek, Molly Klaus, and finally Perry Kadenoff, the head of my Organized Crime Task Force, and Pat Carrington, Assistant Deputy Attorney General, who is the lead prosecutor in this investigation. Today's announcement is the result of an ongoing investigation by my office's Organized Crime Task Force, the New York State Police, and the Federal Drug Enforcement Administration into a drug trafficking ring that extends from coast to coast. In the course of this investigation, we uncovered a truly vicious new drug cocktail that targets unsuspecting users. As the opioid crisis tears across the state, we know that many people have tried oxycodone or oxy, a powerful opioid that often comes in the form of a blue pill. And you can see here, that's actual oxycodone. That's what the brand manufacturer looks like. Now, oxy is dangerous enough on its own, but what we've uncovered recently takes that risk to a new and a truly frightening level. Our investigators intercepted a package coming from the West Coast. Inside, we found the package stuffed with marijuana. This is what the packaging contained. But inside the marijuana, we found 500 small blue pills that were clearly manufactured to look just like oxy. But when we took the pills to the lab, we discovered it wasn't oxy at all. It was something much more dangerous, a toxic mix of acetaminophen and fentanyl, one of the most deadly drugs in the world. And you can see, these are pictures of the phony oxy. It's got the M in it. It's got the line in it. It's designed to look just like the oxycodone that comes from a pharmacy, but it is extraordinarily dangerous. A dose of fentanyl just the size of a few grains of sand can be lethal. It is cheap, and dealers who are unconcerned with its effect on people's lives are mixing it into other drugs to make higher profits. That's what makes these pills so dangerous. Users think they're getting a prescription-strength oxy pill. Understandable enough, because the pills are exact copies, but we are making this announcement today really in the interest of public health. The pills that are circulating on the streets of Western New York now are potentially killers. The mix that a drug trafficker makes in their basement with no quality control can have a grain or two of fentanyl and produce a high that you survive. Another pill may have too much fentanyl and be deadly. Taking these pills is like taking Russian roulette. Playing Russian roulette is not something that we want anyone in Erie County to do. The pills are so powerful that you can see from the packaging here, we don't even touch them. Police officers have had adverse effects simply from touching fentanyl. That's how powerful it is. So you can see that we only have touch it with gloves, and it's inside 2 different plastic containers. The pills are unpredictable. They can kill. They will kill. They've killed people before. In California, pills laced with fentanyl have been linked to dozens of deaths, and these pills are now making their way from the West Coast into New York. So as far as we're aware, this is the first time these pills have been seen in Erie County. There were reports of a small number of similar pills on Long Island this summer, and our investigation is really covering the entire nationwide network that is shipping these deadly pills into our state. The investigation is ongoing. I will not be able to discuss the specifics of the case very much, but the public health emergency created by these drugs simply was too serious for us to wait. And we've learned that the pills are on the streets in Western New York, and the public needs to know about this serious threat. Sadly, small cities and rural communities have learned about the devastation of the drug epidemic all too well. The rate of drug-related deaths is rising about twice as fast in small cities in our suburbs as compared to New York City. And that's why in April we launched the SURGE initiative, a commitment to collaborating with state and local law enforcement to root out violent gangs and drug dealers. SURGE initiative stands for the Suburban and Upstate Response to the Growing Epidemic. It focuses our resources on communities that have been hardest hit by drug trafficking all across the state, and in the months since we launched this initiative, we've already arrested more than 260 dealers, charged them with more than 1,100 crimes, including conspiracy to commit murder and operating as a major trafficker. The SURGE initiative builds on the work of our Organized Crime Task Force, which succeeds because it does such a great job of collaborating with other agencies in law enforcement. In every case, we have worked. Local partners, like the folks standing here with me today, are critical. They know their communities best, where the resources and attention are focused, and their commitment is deep and passionate. I want to be clear that people struggling with addiction are not and will not be the targets of our Organized Crime Task Force or our SURGE initiative or anything else in our office. That's why we are joined with government agencies and advocates across the state and in Erie County in particular to pursue an all-levers approach to the fight against the drug epidemic, including treatment, interdiction, harm reduction, and education. My office has also taken on insurance companies whose policies made it more difficult for addicts to get treatment, and we are currently a part of a multi-state investigation into the practices of drug manufacturers and distributors. So we understand that you can't prosecute your way out of a drug epidemic. We are committed to going after people who deal these deadly products in our communities, but we're also committed to working every other lever of the system to get us out of this national crisis. And we have great partners in Erie County. I'm proud to stand with them today in this effort. So I do want to make one last pitch. Please, I implore everyone in New York, get the word out. These blue pills are death. No one should go near them unless you stood in a pharmacy yourself and saw the pharmacist hand you a prescription. Stay away from them. Fentanyl-laced pills have killed people, and they will kill people again. So I thank you for joining me here today, and now I want to turn this over to someone who has been an outspoken leader in the efforts to stem the drug epidemic, County Executive Mark Poloncarz.
Thank you. Thank you, Mr. Attorney General. I want to commend you and your staff, as well as the New York State Police and the other members of the task force who helped interdict these drugs. You just said that we can't prosecute our way out of this epidemic, and that's correct, but prosecution and law enforcement is a key part because it is an issue of association of prosecution, law enforcement, education, prevention, and treatment, and we all have a role to play. I've whether it's lucky or unlucky to be named to the National Task Force with regards to the opiate epidemic on behalf of the counties and cities and be the only New York State representative. I'm not surprised to see what it was confiscated here today because it's been occurring across the rest of the nation. We've been saying for some time we hadn't seen these types of pills on the street, these fake pills that actually are not what people think they're getting, but it's been occurring elsewhere in the country. And it's only a matter of time when something that works elsewhere comes here because the drug dealers, they don't really care about the individuals that they're selling their product to. They just want to sell their product. And what they're putting on the street, whether it's fake oxycodone pills or it's just pure fentanyl being advertised as heroin or the other types of ways that they distribute their product, they know they're going to kill a number of the individuals that purchase their product. We try to stay ahead of them in local government as best as we can. In Erie County, our crime services labs have identified 4 different fentanyl-based derivatives that have been found on the street that had not previously been identified anywhere in the world, because the drug dealers and the Chinese manufacturers of fentanyl are constantly changing the derivatives, are constantly changing the formula to keep up with law enforcement and other measures, in some ways to create a better high, but also to avoid the rules that currently exist with regards to shipping other types of fentanyl derivatives through UPS, DHL, FedEx, which currently exist. This is really no different than some of the announcements that we've had to make in the past about what we could call very deadly batches of heroin or other types of products that have reached the street. If an individual takes those pills and they think they're taking OxyContin, as the Attorney General noted, If it has 1 or 2 grains of fentanyl in it, they're going to get a tremendous high. If it has 6 or 7 grains of fentanyl in it, they're going to die. And that's why we need to let the public know that if you are purchasing pills on the street, it is, as the Attorney General noted, Russian roulette. You may live, you may not. We need to let the public know that there is no such thing as a safe base of fentanyl. Fentanyl is a very deadly drug. I commend all the efforts that are being made in law enforcement to get these drugs off the street. It is all part of everything that we do in local government, state government, and nationally to address the opiate epidemic. There is no one answer to the epidemic, but law enforcement plays a key role. Interdiction of drugs and putting dealers behind bars plays a key role. And for those who are addicted, as the Attorney General noted, we need to offer treatment, as we do here in Erie County. We're not going after individuals who are users of the drugs. And if you do use the drug, we want to remind everybody there are opportunities out there to be saved, to be helped. And if you do suffer from an addiction or a loved one suffer from an addiction, we remind everybody we have our 24-hour addictions hotline, 716-831-7007, to help you overcome your addiction. There are many people in this community who care about you. There are many people who want to help you. But the first thing you must do is help yourself by ensuring that if you're out there purchasing drugs on the street, don't, because these pills can be killers. And we want you to know that if you do need help, help is available. Please call our hotline at 716-831-7007, because our community stands united to help you get through your addiction. Thank you.
Thank you. Thank you, Mark. And now the Commissioner of the Erie County Department of Health, Dr. Gail Burstein.
Thank you. Thank you. Thank you for inviting me here today. And we all know that the reason we're all here is because our community is highly affected by this serious public health crisis, opioid addiction. In 2017, so far in Erie County, we've had 112 confirmed opioid-related deaths and 132 suspected opioid-related deaths. We also know that straight fentanyl is 50 to 100 times more potent than morphine, and the fentanyl analogs are even more potent than that. And we also know that just a few grains, such as the grains found in these pills, can be deadly. And so far in Erie County in 2017, among our confirmed opioid-related overdose deaths, 83% had a positive tox screen for fentanyl, whereas 25% had a positive tox screen for heroin. Fentanyl is killing our residents. They're killing our loved ones, their sons, our daughters, our siblings, our BFFs, parents of young children. And so, again, we are all here today because we all want to work together to fight this epidemic. And public health has a great partner in law enforcement. Traditionally, we have not been good bedfellows, but I think this epidemic, we've learned how to work together, and we've become strong partners. We've also, the Attorney General mentioned that acetaminophen, or Tylenol is the known brand name, is also in these pills. So acetaminophen is not always a benign drug. In high doses, it can lead to acute liver failure, and even at times it can result in the need for a liver transplant or death. So these drugs are very, very dangerous. Again, if people are using, now is the time to put down the drugs, to stop using. As our county executive said, call our hotline, 716-831-7007. There is a place that people can get treatment, and they can get on the road with recovery, with medication-assisted treatment with either buprenorphine or methadone. So really, there is hope. There is a way out for people who are struggling for addiction. It's not a dead end. We want to help you, and we want to care for you. So please call 831-7007. So thank you.
Thank you. Thank you very much. And now, a parent advocate and a leader of Erie County's opioid epidemic task force, and we're very grateful for her commitment to this and others who have lost loved ones to addiction, Deborah Smith.
Thank you. As a family member who buried their child, I'd like to tell families there is something you can do in this epidemic. We ask that you keep your loved ones close. Watch them, because they don't fully understand the disease that they currently have encumbered. Their brain is hijacked, and they may not be able to navigate this dreadful disease by themselves. Please do call the Addictions Hotline, 831-7007. Please use the language of love in order to embrace your loved one so that they'll know that they're supported and they're cared about. Get trained in Narcan. It's a life-saving tool. Please let your loved one know that they can get help. Medically assisted treatment is available in our community. We can't talk our way out of this disease. Help is available. School is in session. Our younger population may not be aware of the danger the predatory drug dealers are posing in our community. We need to watch them closely now. Thank you. Thank you to Erie County Mark Poloncarz. Thank you to Eric Schneiderman and the task force for the life-saving effort that you provided in taking possession of this lethal substance so that more of our community members will not pass needlessly. Thank you.